culture.
The
PPD, ma'am.
Go to basic.
PPD, the Montex test.
Very good. PPD. PPD.
Yes, ma'am.
Montex test. Montex test. Okay. Skin test.
Tuberculosis skin test.
Yes, tubercular.
Sputum test, ma'am.
Sputum test. No, what is the other name? If PPD, Montex, TB skin test. So these are the three names to one diagnosis only. What is PPD?
Sorry, ma'am.
What is PPD? What is the full form of PPD?
Positive protein.
Positive protein, no. PPD. Roshan. What is the full form of PPD?
Ma'am, protein derivative.
Purified protein derivative. Purified
protein derivative.
Very good. Purified protein derivative. So basically what happens when we take the bacteria, we remove their protein and we inject our body. So for example, okay, route is you're given through your ID, intradermal. So what happened over here? We use a flat surface. So I can use my anterior forearm. Exterior, anterior forearm. Okay. So I can inject intradermally. Okay. Yes, intradermally, for example. Just take this thing. Okay, just imagine this is the, so I have injected this, okay, in my skin, and I'm going to mark this with the pen.
Yes.
This is what we do.
Yes, ma'am.
So like, for example, this, okay, so injected. So when I'm good, just imagine this is my hand does not look like this. Okay, just I'm making you for to understand. So this is what I have put in my skin, and I'm going to make a, so whenever I put this injection intradermal parallel to the skin, intradermal is intradermal injection. You also call it as insulin syringe. Okay.
Yes.
A very thin needle is used. And then you are going to mark this area. And then you're going to write the date, the time. Okay.
Time.
And you will ask the patient to do not rub this line. Do not erase this line. Okay. And after 72 hours, you are going to see the induration or the how much it has been spread. If it has been spread up to 5 mm, more than 5 mm or up to 5 mm, then if, okay, just imagine one thing. If a patient is immunocompromised, for example, a patient is with HIV, okay, and there is induration of more than 5 mm, that means the patient is positive.
Positive.
Okay, not means positive. It means that consider positive. Okay, we will not say the 100% surety. We will say, okay, we will consider it is positive. Okay, but in a patient who is non-com healthy individual like you and I, okay, HELTHY healthy individuals, then if it is more than 10 mm, okay, if it is bulge more than 10 mm, then mean we consider them positive. Okay, understood? Next, do not take or check the Montex test if a patient has received BCG vaccine in last 10 years, within 10 years. Like, okay, so children 9 years of age, if you take their BCG, already they have a protein of BCG in their body. So what will happen? So your protein will get more infiltrated. So you're now going to do your BCG. Okay, let me show you a more dramatical BCG. it is more than 5 mm, if the patient HIV or recent contact with active PV patient, nodular fibrotic change in chest X-ray, organ transplant, mean the patient is immunocompromised. If there is equal to or more than 5 mm, it means that a patient is considered positive. If it is more than in a patient who is less than 5 years old or high prevalence country, IV drug user, resistant to the comorbidity condition, children, infant. So if it is more than 10 mm, we consider it
10 mm.
positive. More than patient with no his normal people, never had TB in their life. Okay, the people who are live in Canada, US, because TB is a very like European people. So there's no prevalence of TB. Write it down. It is very important. Just write it down. Note this thing.
If this disease is not common in USA, so will they ask about this in NCLEX or not?
BCG vaccine it is not common. BCG is not a routine vaccine of those country. In NCLEX, we do not study about BCG. We have a different guideline for BCG. They don't have this disease because this is very, first of all, this is bacterial, okay? And this is not prevalence in their country. It's like it's spread from 1% to 1%, 1% of people. So they haven't had, but they might have, some people might have. Okay, Junaid, Farhad. 50 years from now, earlier, we did not had obesity in our country or asthma or what we say, more of a cardiac problem or diabetes. Very rare people have it. Like, genuinely very rare people have it.
Hypertension.
But nowadays,
Especially cancer.
Yeah.
cancer. But now we are having it more. Earlier they had cancer. In our India, very few. When we were kids, we never have heard of cancer. Honestly
Yes.
speaking, I never heard about cancer or diabetes, something like this. Only infection, TB, I have heard of it. And you have also, in your country also. But nowadays, every second house is being, India is the capital of diabetes. So, because there's so much of population.
Yes, ma'am. We are also not behind. Ma'am. Don't worry.
Yes, we are also, this is happening. But that's why. This was not our disease, honestly speaking. It was forced into our country. We had a good lifestyle. According to the temperature, we were eating roti, sabji, dal, chawal, good food. We were having good life. But we are so much of brainwashed with pizza, burger. When I was a kid, I was in 10th class, I had pizza for the first time. But nowadays, eating pizza is so normal. And I remember pizza cost me 100 rupees and that was a big thing. Like I asked pleaded in front of my parents, like 1 month continuous, let me eat pizza. Before that, I never had pizza. I'm not kidding. I'm not saying that like you feel it very abnormal, but okay, I'm just saying my your generation. You must have also heard it. But nowadays, the fast food trend has been increasing so much that you know how kids are. They have been incorporated with phones so much that every I'm walking in the road, I'm seeing children, they have their own phones, they are scrolling reels, and parents are making them to scroll reels because they are disturbing them. If you're
Ma'am,
not giving
6
them
to
phone.
7 years of child said like my body aching, my legs are paining, my knees are paining.
Yes, and you won't believe I have seen a student of seventh class
Yes, ma'am.
killing parents for phone,
Yes, ma'am.
Yes,
doing
ma'am.
suicide, active on TikTok.
Seriously.
Yes, ma'am.
I honestly speaking, I'm not saying we had also have so many, we had TV, we have Sonpuri, we have Hatin, we have Shakalaka Boom Boom, we have Shaktiman. We were
Yes.
also addicted. I'm not saying we were not addicted, but we have that tendency to wait. We had the tendency to wait for the next day. Ki, acha, kya hoga?
Right. Oh, ma'am.
Yes, we had that guts to wait for the next movie. I don't know how much of you remember there is something called DD National. So half movie
Yes,
was
ma'am.
seen one day, the half movie was second
One
next day.
channel.
Oh,
Okay,
Now
but
our
we are
kids,
going on a long hat.
now our 2 years babies also with phone only they are eating.
Yes, 2 years. What are you saying? One year child. They know better than us.
Yeah, simply they scroll the apps and find the YouTube and they seeing the reels.
Yes, the most consumption of these social network is children nowadays, and people are targeting them. So we don't know, this is a very black market. Okay, leave it. Less about tuberculosis. We went so far about it. Understood this thing?
Yes,
Yes,
ma'am.
ma'am.
Okay. Subain Khad, I think your country will be also having the same problem. Farhad?
Yes,
Farhad?
ma'am, it is same. Yeah.
Same.
We said it's same, yes.
What can we do now? Okay. Next thing. So did you understood about your Montex test? Apart from Montex test, we have one thing which is known as sputum. Sputum culture is a gold standard. Sputum culture is a gold standard. Okay. Understood? Okay.
Yes, ma'am.
Next. Let's talk about some of the bacteria characteristics. You have to just know it. That's why I'm telling you. The bacteria are acid-fast bacilli. Acid-fast bacilli. Okay. Like they take stain. Okay. So you have to always take sputum. So how will you take sputum?
Early morning,
Morning
ma'am.
culture. Morning culture, empty stomach, fresh sputum. Take three. Okay. Take 3 sputum at alternative days. Okay. If all
Okay,
three are
ma'am.
positive, if all 3 are positive, then we will consider the patient is positive. Then we will consider that patient is positive. Okay. You have to take 3 consecutive sample. And if all 3 samples come out to be positive, then only we are going to consider that the patient is positive. Understood? Okay.
Yes.
Next.
Yes, ma'am.
just X-ray भी होंगे
Sorry, Rosaline.
X-ray
Sorry.
just X-ray
Yes, I'm coming to that topic only. So, okay.